So good evening, everyone. Thank you so much for joining this month's Q&A for the Real World Parenting series. We are so glad you joined us this evening. This is one way that we can continue to provide support and resources for you all as parents and caregivers, because we totally understand it is harder than ever. So thanks for joining us today. I am very pleased that we're able to continue to provide these Q&A sessions and the videos that are posted on Facebook and our website in advance of these Q&As. So this evening, we are very lucky to have Miss Dana Schwarz joining us for the Q&A. She is our substance use disorder team manager, and she is going to answer some of your questions and provide just some general overview information, because we know this is a hot topic, just in general and especially of late. So Dana, I am happy to have you here today.
Thank you. I'm happy to be here on this cold, rainy, dreary May Memorial Day weekend coming up day.
Yes. Well, very good. Well, do you want to just kind of introduce yourself and tell folks a little bit about your experience and kind of go from there?
Sure, absolutely. So I have been at Family Service and Guidance for almost a year now, which seems crazy to me, but it has been almost a year. Prior to that, I worked in the community at several different places, providing substance use treatment, evaluations, worked in the juvenile prison system for a while. So my focus has primarily been on juvenile treatment. I have done concurrent adult stuff along the way, but my focus and my passion is absolutely adolescent treatment. Of course, one of the things we want to focus on always with our kiddos is prevention. And just never starting the problem, so that, starting the behavior, so we don't have to worry about the problem in the long run. But the other part of this is what happens when we get to that place of, I didn't realize this was going on, and now we find out it is going on, and our kids maybe need some help to stop with that. And so I'm hoping, that's one of the things that we'll talk about tonight, and give some parents an idea of what to do with that in that situation. And then also just to let everyone know that Family Service and Guidance is now doing substance use disorder treatment. We can now help kids, we kind of cover the whole basis of mental health now, which is great. It's a wonderful place to be able to provide not only the mental health services that we've already been providing for a long time in the community, but add to that and provide some substance use treatment too.
Excellent. Thank you. Yeah, we are thrilled that you joined the crew, the team too.
Thanks.
Yeah, for sure. Well, how about we start off with some of the statistics, general overview. What are you seeing? What are we hearing in the community around us?
Absolutely. So it's really interesting. I want to throw out there first and foremost, if you have if you're really curious about the area that you live in, or the state the county that you live in, or even some of the urban areas, there's Greenbush does a survey every year in the school system that asks questions. And it's called the Communities That Care Survey. And that's actually, anyone can go on their website and see that information. So I want to put that out there first and foremost, so that families can do that if you're really curious about what's happening in your specific area. But one of the things that we see the thing that I see the most by far and away is marijuana, alcohol, and vaping of nicotine. Those are by far and away here locally our biggest struggles that we have with kids using any kind of substances. We do see some of the opiates. We know we have the opiate pandemic happening all around our society and in our country. But we do see that here. I won't tell you it's a huge portion, but it is a significant portion, meaning those kids who are using those things really do need the help and the guidance to get out of it. Statistically speaking, it really fluctuates as far as how many kids are using, what they're using. And there's so many statistics around that, meaning some of the statistics are who's used in the last 30 days, who's used in the last week, all of that kind of stuff. So it's hard to really pinpoint when we talk about statistics. One of the things that I always want to put out there when we talk about statistics is, though, and it's also a preventive measure, but if we can keep a youth from not using, the longer we can keep them in that place where they're just not using, they're abstinent, the likelihood of them going on to develop any kind of disorder drastically goes down. So if we can keep them to the age of 18, it goes down about 10 to 20%. If we can keep them to the age of 21, it goes down to developing about a 15 to 20% chance of developing a SUD disorder. And that's pretty significant if we compare that to the average usage, the average age of usage in the United States is 12. So that's first time usage at 12 years old. And we know that statistically speaking, when you're starting to put chemicals into your brain at that point in time, there's just a much higher chance of developing a disorder.
Okay, very good. Hey, I see we have Torin and Joseph joining us. Thank you so much. Before I forget, and I'm sorry to get off track, Dana.
No, you're fine. Totally good.
Thanks. Torin and Joseph, if you need a certificate for participation, please just type that in the chat for us. We'll make sure that we get that to you tomorrow or at the absolute latest early next week. We are really glad that you have joined us, and we will kind of go over the questions that we have. But please, both Joseph and you, Torin, we want to make sure that tonight it's for you. So if you have any questions, please don't hesitate to ask them. That's what we're here for tonight. And just so you know, too, we are recording this presentation because it's our goal to continue to provide resources and information to the community. So just wanted to give you that heads up as well. So thanks again for being here. So you covered kind of this gosh, hard words are hard. Statistics. One of the questions submitted too was, and this is going to be a difficult question to ask, but maybe you can provide some information around it. The person said, why is there so little help for youth needing help with substance use? And then, well, I'm going to stop there. There's a couple of follow-up.
Yeah. So what a wonderful question. Thank you first and foremost for asking that question. So it's a complex answer. So one of the first things is that when we look at youth from any standpoint, they're what we consider to be a more vulnerable population in society. Meaning we don't do experiments on them. We don't do research on them. We don't do those things because they're children. And so that in and of itself means that there are more rules, there are more guidelines, there are just more things that cause, unfortunately, some red tape to getting kids into those services. So services have to look a lot different. And sometimes because of those services looking so much different and having to be very specific, therefore there's a much higher cost associated with them. And people and businesses don't take it on. So there's one component of it. Another component of it is that it's a specialized world. Not everybody loves adolescents to begin with, and not everybody loves to work with them specifically on substance use disorders. Another component of that is the stigma that we associate in mental health in general. And then even higher, even more so with substance abuse disorders. We tend to look at the behaviors and not the people. We forget sometimes that those behaviors are just, hurt people. They're acting out of their illness. They're not intentionally trying to hurt anyone. And so those behaviors aren't always great. The stigmas that go along with it, we don't like to, it's hard to fund those things that have bad behaviors associated with it, but also because kids change so much. their biochemistry, their brains, everything about them is changing and developing and growing literally daily and weekly. And so treatment of them is just harder because of that. I'm hopeful. We are growing. We're growing here. We're going to have some new programs coming. It's really exciting for us. I'm hoping that we are opening those doors as we speak to having more opportunities to helping our youth, because we know it's a problem. So yes, but it is absolutely way harder for the kids side of it. And I think there's more to that question too.
Yeah, there is. So second piece of it is, how do we as parents protect the kids when there is so much social media available on school devices to buy and sell drugs, etc.? So what can those parents do?
Oh, so I have teenagers myself. I get it is so hard. The number one preventative factor, research has, try to say that fast. Research has shown over and over and over, the number one preventative factor for any kind of substance use, truthfully, any kind of those risky behaviors that we don't want kids to engage in. The number one preventative factor is talking to your kids, those tough conversations, and they are hard. I do this for a living. It is still hard when I have to apply it at home to my own. It is by far and away the most beneficial thing. Even when there's eye rolling, even when they're like, yeah, whatever, they're still listening. So there's the first part, is have the conversations. And when I say conversations, I like to elaborate and say, listen. So we as parents sometimes get stuck in that adult head and think that we need to do all of this. And a lot of times it really is, they just need a safe place to explain what their feelings are around those things and what is happening to them, what is getting sent to them on their school devices. Yes, as quickly as the schools can shut it down, somebody is going to find a new way to do it. And that's, I wish I could tell you technology didn't work that way, but that's the downside of technology. And our kids are way smarter at it, at least at my house. They're way better at the technology side of it than I am. So I think that's another component, is I try really hard to stay as educated on how social media works, what the different apps are, what are the dangers that go along with the social media themselves, but then also what material is coming through. What are my kids looking at? Let's have a conversation. What are you talking about? What's going on? What's in your wheelhouse? Who's talking about what? What are your friends doing? What are they talking about? And I want to, those conversations, a lot of times us parents want to be like, okay, everybody's at the dinner table, we're going to talk about this, or we're sitting in front of the TV, we're going to talk about this right now. And I will tell you, one of the things that I've learned, both doing this professionally and with my own children, is some of those conversations, the best conversations, are the impromptu ones. Those are the ones that are happening when we're sitting in the car. Those are the ones that are happening when we're on the way to school or on the way to the event, or, hey, what's going on with such and such? You told me last week they had a bad week. What's going on? Where are they at? How are they handling it? Are they drinking? Are they, are they doing those things? Are these things coming into your world? You're not in trouble, but let's talk about it. How are you handling it? And I think the other side of that also that goes hand in hand with that is clear expectations and guidelines. So as parents, if our expectation is that we don't want them to do whatever that behavior is, then we need to lay out for them from a very young age, this is my expectation of you. And if this happens and you do these things, these are the consequences. And then when those consequences come around, we stick to those consequences. It's really hard to be a parent today, because it's really hard to be a teenager today. And so there's no way to not be hard. And there's no way for that not to be hard for parenting too.
And that specific point was emphasized when I sat in on a meeting with our youth suicide prevention youth forum. We meet with the kids at least every quarter. And just at this last meeting last week or the week before, the students asked us, they said, we don't feel like our parents truly understand how hard it is. Can you all figure out a way to help parents understand all the pressures? So you hit it on the head when it's having those conversations and truly saying, hey, tell me about it. It's a safe space. I'm
Yes.
not going to get judgy on you. I'm not going to call that person's mom because you told me.
They have to feel like we're approachable. It has, if you want your children to come to you in those times where things are really, really tough, right? And we know as adolescents, I mean, those of us who are listening, we didn't get to this age without being adolescents. We all know what it's like to be an adolescent. But I can tell you just, one of the things that comes up quite often in the office is things with social media, right? So back in my day, if you were bullied or you had a bad day at school, when you got home, you could shut that off. And that doesn't exist anymore. It is hard. It is hard to be inundated. I mean, it's hard as an adult to be inundated with that kind of information. You don't have to look very far to find things on the news or social media that just is devastating. And so as a kid, they're not equipped. But to be able to have that person where they can just, you don't have to fix it. As parents, we want to fix it, right? Like that's what we want to do. You don't have to fix it. You just have to listen and say, you know what? I'm so sorry that it's hard. It's temporary. It'll get better. It will get better. But I am sorry. I'm sorry that you're struggling. What can we do to make it better? That's what it is.
Yep. And the last piece of this person's question was, and boy, I don't know that anybody can pinpoint this, but how is this happening so easily during and in schools? I think you hit on it. I mean,
here's the deal. If we have people in this world who can hack into the CIA, they can hack into any of your school systems. And it's pretty easy. And I'm sorry, I wish that we did, again, we're back to that same question statement. I wish we didn't live in that world, but we do. And so, we can only control what we can control, what's in our house to control and what we can take care of. And so again, limiting as much as you can, helping have those conversations, I'll tell you another thing that's incredibly important, I think, with that, especially where it's happening in schools or on school devices, is making sure the school knows also. And not, it doesn't have to be hateful. It doesn't have to be just passing the message along of saying, hey, did you know? Because I don't always know that our schools are as up to date. We're really great as parents to come, to talk and commiserate amongst each other, but we're not always great because we don't want to be the problems, or they already know, somebody else already told them. And a lot of times they don't know. And so they can't fix something that they don't know. But I do think that, like we had said earlier, unfortunately, we put one Band-Aid on and then they just find another hole to go through. So it's really hard to stay ahead of the game when it comes to that technology piece.
Yeah. And I know, each and every school district is doing everything they can. It just moves.
It is a full-time job just for that component of IT.
Yeah,
yes.
Exactly. Let's see here. Another question was, can you fill us in on vaping and its effects and how predominant? What are you seeing?
Unfortunately, we don't have enough time on all of the effects. None are good. So let me put that out there to begin with. There's nothing good to be gained by vaping, whether you're an adult or a child. We have somehow or another, and I'm not sure how that happened in the marketing of vaping and the technology of all of that, but somehow we have made this look like a healthier way or a healthier version of what tobacco was. That's not true. So yes, they took out some of the chemicals that were dangerous, but in taking out those chemicals, they add in other chemicals and addictive principles and all of those things. But when we look at just purely the tobacco and the nicotine based vaping, so one cartridge of nicotine it's more than a pack of cigarettes. So yeah. So we have kids who are using a pod, which is the piece that plugs into the device, however they're using it, however they're vaping. And that is more than a pack of cigarettes, and they're using a pod to a pod and a half a day. And it is not uncommon for me to have someone who comes into my office and tells me they're using a pod a day, but they don't think that that pod a day is equal to a pack of cigarettes. And in this day and age, we have educated so well. We've done such a great job about the non-smoking thing with cigarettes and tobacco. We did great with that. The numbers really decreased, and our youth, I even now I'll ask kids about smoking, and well, I don't use cigarettes. That's gross. So that whole idea that the cigarettes are gross, but not the vaping, it's okay. And so I think really it's just having some of that is having that conversation with our kids. Look, you have to know this. Vaping is hard. There's very little smell associated with it. There's very little signs associated with it outside of you actually finding the vape. It's hard to keep track of, which is why we are having such an epidemic of it right now. One, everyone thinks that it's safer. Two, it's hard to keep track of. It's hard to smell. It's hard to prevent. And it's accessible. I mean, really, when it comes down to that, that's what it with kids, the easier it is to access, the more likely they are to abuse. It's just the reality. It's a supply and demand thing. And it's not legal for them to have anything. So because we have vaping is one of those things, it kind of goes along with alcohol. Alcohol is usually more accessible because we sell it on the corner stores. It's just there. And so the more accessible things are, the more people engage in them. And then the misconception that it's not dangerous. I would highly recommend, if you have a youth who's using some kind of tobacco product, that you get them into some kind of services, whether that's with us or with another facility or something, and have them evaluated, because that we can be setting them up for a lifelong habit that we don't want to set them up for. And if we can intervene now versus 5 years from now, the likelihood of them continuing that lifelong pattern goes way down.
And then also, how does that getting them into treatment quicker, earlier, equate to the effects, when you talk about the effects of vaping?
Yeah. So obviously it's one of those things that if they're not abusing it over a long period of time, we're going to see the risk of lung damage go down. We're going to see the risk of the plaque that's built up, the teeth damage, all of those chemical buildup and the side effects that happens from all of the chemicals inside of it. We're going to see the side effects that go along with those things. The less time that they're using it, the less side effects, the less effects that they're going to have. Ideally, the other side of that is the invisible side that you don't necessarily see. So the more often that we create that pattern in our brain that says, when I'm stressed out, I smoke, I vape, I feel better. We're creating that pathway in our brain that every time I feel stressed out, I need to smoke. So if we can intervene sooner rather than later, that pathway doesn't get to be like a really thick concrete street. It doesn't, so it's not as ingrained, it's not as hard to break, which then hopefully will help with a lot of the other problems down the road too. It just makes it easier to stop, as opposed to if you've been doing it for a long time.
Very good. And actually, I was at an event last night, and I visited with a couple of officers from the Topeka Police Department. We were talking about this subject a little bit, and one of the officers said what he personally is seeing, and he's not an SRO, he isn't embedded in a school, but he said what they are seeing just a ton of are middle school kids vaping, and those cartridges have THC in them.
Yeah, so that's, I would say probably not just, unfortunately, an adolescent thing. We're seeing that kind of across the board. So we're surrounded by 1, 2, 3 medically legalized states. So therefore, it's going to make it easier for our children to get a hold of any of what we consider the dispensary grade or dispensary type stuff that's going to be coming out. What we're talking about is coming from a dispensary. That's not it's not coming in from the cartel. It's not, it is legitimately coming from the dispensaries. And so, and again, we go back to that, it's safe, right? Like it's coming from the shop, so it's safe. And so when we start looking at those, we're right back to that vape conversation. Less smell, easier to hide, easily accessible. It becomes even more so of this kind of epidemic that we're seeing with vaping and technology. As we adapt with technology, it's becoming easier for our kids to get a hold of things and use them without anyone catching them. I mean, I'm assuming most people know what the smell of marijuana is. And if you're smoking marijuana in the bathroom at school from a plant, they're gonna know. There's no way somebody in that school is not gonna smell that, because it has a very distinct odor to it. Whereas if it's vape and it's got the THC in it, they may not smell it. And so it's just way easier for them to use those things. And now, because of the supply and demand issue or supply issue, it's easier to get a hold of.
Yeah. Yeah. And I think no, that's not true. Another question is, how does it affect the kids when a parent uses or abuses substances?
Yeah, so the simple answer is yes. Now, I want to make it very clear, there is a difference between occasional or recreational usage that has no negative consequences associated with that usage associated for the adult in the home than regular daily or regular usage that's causing negative consequences. And I say that because I don't want everyone to be like, you can't have a glass of wine with your kids, or that's not what I'm saying. Please don't hear that. So what I'm saying is, the more we normalize, doesn't matter what we're talking about. Let's talk about alcohol. The more we normalize alcohol, the more our children see us engage in that behavior. The more our children see us under the influence, the more our children see how we behave when we do those things. We are shaping what their guidance is going to be without even realizing we're doing it. So I always say, if you come from a home where every day since the day you were born, you ate dinner at 5:30 because that's your rule. When you leave that home, most likely when someone asks you what time you're going to eat dinner, you're going to say 5:30. Not because there's any rule that says you have to eat dinner at 5:30, just because it's 5:30. If I'm raised in a home where there are people who are using on a regular basis, and I see it on a regular basis, it then becomes my normal. The likelihood of me engaging in that behavior goes way up because I see it as being normal. The other side of it is that when we have adults that are engaging in substance use on a regular basis, the likelihood that they're fully mentally and physically present for relationships with their children and other family members goes way down. If you're in an altered headspace, if you're in an altered way of thinking, you are not fully engaged. You can't be. It's just how it is. When we use, it affects our brains, and what allows us to be completely engaged, our brains. So that sets up a huge problem for our children because they want our attention. They want us to be focused on them. They want us to be with them and not just physically with them. They want us the mentally engagement part. So it really does affect our kids and how they view their parents, how they view their relationships, how they view themselves, how they view the structure and the security of home based on what's happening around them. And it's not just substance usage when we talk about those things, it's a lot of things, but yes, absolutely. It affects the children. It affects everyone in the home.
And the last question that was sent in before this was, the most common one affecting families and communities. I'm assuming a little bit which substance is what I think what the question really gets down to.
That's a big question. So it doesn't sound big, but it really is, especially when we talk about families versus communities. So if we want to talk about which drug is used the most and affects like the most people, it would probably still be alcohol, to be honest with you. Like that's probably what the most people in the United States are still engaging in. That's what research is showing us. It's the most used substance. Now, if we want to talk about that from a causing like problems in our community standpoint, then we're going to have to look at the opiate epidemic that's happening right now. We are literally losing lives daily from opiates. And we have not seen it to the extent that some of the Ohio River Valley and the coast have seen it, but it is here and it is happening. And so it by far and away is costing us more money. We have a lot of people going to the ER. We are putting medications in the hands of family members to reverse effects of opiates, to try to save lives when we need to. We are having emergency vehicles and emergency services, working on people who have unintentionally overdosed. We have the cost of housing them in the hospitals. We have the cost of housing them in prisons. Those are the most expensive places in the world for us to keep people, hospitals and prisons. And so when we start looking at that kind of stuff, the opiate epidemic has by far and away really shook society. We lose a lot of lives financially. We're putting a lot of things into that area. And so again, it's really difficult to gauge that question because it's such a broad thing when we talk about that. But those would be my two biggest things around here.
Yeah. Okay. Are there any other, topics or specific things you'd like to share that you think are really important that might not have been addressed in the questions that were sent in prior?
They did such a great job of those questions being so broad that it covers a lot of the things that, we talk about. Again, I will tell you over and over and over again, prevention. You can't start talking early enough. You're not glamorizing it. You're not making it look like you're talking about it is not going to make somebody use.
Much the same as suicide. That is the biggest myth about suicide.
Yes. If we talk about it, then they're going to kill themselves. No.
Right. No.
If we talk about it and we give them other skills and we tell them what to do if they feel that way, then we've given them tools to manage in that situation. And the same thing comes to substance use and any risky behavior, honestly, is, we need to talk and we need to talk and we need to talk. And when you think you've talked about it enough, you need to talk about it some more. And they'll roll their eyes and they'll do the I know, but it really needs to be just like, how was your day at school? What are we having for dinner? What movie do you want to go see this weekend? Those conversations need to be repeated the same way, because then our kids know it's important, right? Because what's important in our lives, we put time and effort into. So if we're putting time and effort into having that conversation and saying those things over and over and over again, they understand how important it is. They understand how much mom and dad don't want me to engage in this, or my caregiver doesn't want me to engage in those things.
How early? What age? And I know there's no magic number, but as a provider, as someone who works with kids who are struggling, when would you recommend to start having that conversation?
I can tell you with my kids, and I kind of, this is my rule of thumb with a lot of those kinds of conversations, the point in time, because little kids they'll ask. They're great. Mm-hmm. I love littles because they'll ask those kind of questions, and because they don't know, right? Like there's no weird society boundaries for them. So they're like, hey, what about? The moment they start asking questions, and whether we're talking about, suicide or mental health or any of those things, the moment that they show an interest, that they are talking about it, or they're asking questions about it, or they bring home the DARE flyer from school, or the coloring book, or whatever those things are, the moment it comes on their radar, that's when I would start having those. And here's the thing, it doesn't have to be like, you don't have to sit them down for a 2-hour conversation of don't drink, don't drive, no. You just answer the question as clearly and as concise as you can, and give as much safety information in that moment that you can, and wait for your next opportunity.
Yeah. And two, I found with my son, after I, answered a question, I would also go back and say, hey, and you know what, if anything else or if you have another question, please ask,
Absolutely.
so that they know that's a safe conversation, that line of communication is open, and you're going to answer their questions or, support them.
Absolutely. And I think that is so, we're talking about substance use, but I think in general, when we talk about anything with raising kids is hard. It is hard. You're not given a manual. None of us walked out of the hospital with a manual that says, hey, when this happens, you do this. And we're all kind of operating blind over here, and trying to make our best decisions. And I believe that people do the best they can with what they have the majority of the time. And so I think that you're setting, just like you said, you're setting the groundwork at those young ages for them to know when they get older, and I am an adolescent and I am in school and somebody's vaping in the bathroom, I can come home and ask my parent, what do I need to do with this? And I feel safe and comfortable. And that's really the most important part of all of this, is that our kids are talking to us and they feel like they can communicate with us and that we can provide guidance back to them.
Awesome. So Joseph and Torin, did you guys come up with any questions since you've registered, or just since we've started talking about various things? I'm sure Dana would be happy to answer your questions.
I would love to, if you have any.
Feel free to unmute if you do have questions. Oh, okay. Well, Torin just said, I think all my questions have been answered. Thank you. Awesome. That's what we like to hear. But we are always happy to answer questions, because like we said at the beginning, we know it's hard. And things are changing, and there are so many different challenges. Feel free to throw anything out there.
Or if it comes up later, our phone number is always there. We're more than willing to have those conversations at any point in time if we can help families with those things.
Absolutely.
All of them. Joseph, the answer, that's a great question. What school districts are more likely to have substance abuse problems in teens? And the reality is if there's a teenager, you're more likely to have a substance abuse problem. Teenagers love to experiment. That's what they're supposed to do. They're supposed to be doing, how their brain develops is they're supposed to be figuring out where those boundaries are and figuring out who they are in life. That's the time that they're supposed to be doing that. And so when we start looking at things like that, school districts, it's hard on the schools in general to be able to keep from having any kind of substances in the schools. But the reality is that wherever they're at and whatever school district there isn't really one that I would tell you is more prevalent or not. It really is. It's just everywhere. I think. Is there any other questions? Comments?
Boy, they've kept it easy on you, Dana.
They did. That was super easy tonight.
Well, and I just want to reiterate too, Family Service and Guidance Center specializes in treating kids with all kinds of mental health challenges, as well as now, thankfully, substance use challenges. And just in case, we sure hope you never have to deal with this, but we do provide crisis services 24/7, 365. So if a child or teen is threatening to harm themselves or others, or just completely out of control, that's where we can be of great assistance, because we have folks specially trained in crisis, in mental health crisis. And it is simply a matter of calling our main number, and we will, visit with the parents, the caregivers, whatnot, and determine best, next steps and de-escalate the situation. We just never want people to be in that situation and not know what to do. So
yes, absolutely.
yeah.
So Pam, we did have one more question.
Oh,
And,
good.
Torin, that is a fabulous question. So I've noticed the show Euphoria. If you have, it's on Netflix. I believe it's Netflix, or is it HBO? I can't remember. It's on one of those. Has become popular. Do you think it makes substance abuse look glamorous? That's a really hard one. I don't think it makes it look as glamorous as things I have seen in the past. So let me put that out there first, because now I will tell you, I haven't watched all of it, but I've seen enough, or I feel like I've seen enough to speak to it. It does show the downside of substance use. It does show some of the negative aspects that go along with it. And I think that's incredibly important. And it also shows the component of the idea that substance use disorders and substance use in and of itself is just a way for someone who's been hurt to try to manage the pain. Historically, in our world, we look at substance use disorders as like this moral failing, or this, bad choices, and all of these things that we, really judgmentally come from. And in reality, research continues to show us over and over and over again that substance use is a coping skill. It's not a good one. It's not the one we want anyone to choose. But ultimately, when we get to that place of abuse, that's really like in Euphoria, the show, it's really to cover up pain. It's really our way of trying to make things okay. And so I don't know that I necessarily feel like it's glamorized it. I will tell you, it is a show that I truly believe none of our children should be watching on their own without parental guidance. And here's the other side of this. What a great way to have those really hard conversations. What a great way for them to be prompted. As you're sitting there watching a show, those things naturally happen, right? We just naturally have those conversations with people who we're watching movies with or TV with. And so there are some really hard topics that come up in those shows. And I think it is a really great way, especially if you don't know kind of how to approach some of those things. It gives you an opening. It gives you the place to start with your kids and say, oh, well, what do you think about that? Or have you been in that situation? Or has that happened to you? Or do you know someone that's happened? It's a place to start. It's not the way I'd necessarily love everyone to do it. I don't want everyone to see those kinds of things necessarily, because I do think some of it it's not my favorite show out there. But I don't know that I think it glamorizes it as much as we have historically done in TV shows and things like that. Thank you, Torin. That was a wonderful question.
Very good. Anything else, Torin and Joseph, that you can think of? Great questions tonight. All right. Well, I will get those certificates sent off to you tomorrow or early next week. Again, thank you so much for taking your time. It says a lot for those of you who join us live, and for folks who go back and, maybe they got busy and are watching this a week later. As we said, it's so hard, and we're happy to be able to provide this information and resources and tips and help in any way we can. So thank you so much for joining us this evening, and hope you have a great rest of the week.
Yes, thank you. Thank you, Pam. It's been great.
You bet. You bet. Take good care, all.
Bye-bye.
Bye-bye.